Welcome back to the Aberdeen Audiology YouTube channel. I'm Dr. Tom Goyne, Chief Audiology Officer at Aberdeen Audiology. We have offices in Wayne, Pennsylvania, Malvern, Westchester, Pennsylvania, western suburbs of Philadelphia. And what I'd like to talk about today is auditory processing. It's what the brain does with what the ears hear, basically. And I'll explain that a little bit more as we go along. But so I'll explain in a nutshell what auditory processing is. I will explain how we test it in someone who thinks they may have an auditory processing issue and how we treat it if that person, in fact, does have an auditory processing issue. So, I already sort of mentioned auditory processing is what the brain does with what the ears hear. That's a quote by Jack Katz, one of the pioneers in audiology, and certainly one of the pioneers in auditory processing work. I always sort of say if there was a Mount Rushmore of audiology, he would be on there. And so our ears are really fancy microphones. They pick up sound, they convert acoustic sound waves into brain signals and send those signals up to the brain. But it's the brain's job to figure out what those signals mean and what they're saying, or what they are, what the object is, what's making the sound. As an example, here, at the time of this recording, it's spring here in the Philadelphia suburbs. The sun is finally shining. Birds are finally chirping. And so if I'm sitting in my backyard, it is my brain that knows that those are ears chirping, not my ears. My ears pick up the acoustic waves that those birds are creating when they're chirping, and it converts those acoustic waves into brain signals, but it sends it up to the brain. It's my brain's job that knows that that is a bird chirping as opposed to a dog barking, as opposed to, a plane flying overhead. It's my brain that knows that. But that's a pretty easy example of auditory processing. What is way more difficult is processing speech. By some estimates, we hear about 150,000 speech sounds in the course of a day. That is a lot. Now, when I say speech sounds, I don't mean words. I mean the sounds of speech. So, for instance, if I say the word speech, that's the sound, the p sound, the e sound, and the ch sound. And those sounds, when I say the word speech, they come at you really fast. If you think about it, those are four very different sounds that come really quick, but those sounds are very similar to many other speech sounds that we make. So, for instance, the very first sound in speech, the sound, if you think about it, doesn't sound that much different than, which doesn't sound that much different than, which doesn't sound that much different than sh. It's all, variations of blowing air, right? Acoustically, they are very, very similar. We'll take a vowel in the word speech. We'll take E, right? E does not sound that much different than eh, which does not sound that much different than ah or. So acoustically, these sounds are very, very similar, and they're coming at us really, really fast. And so our brains have to correctly identify those individual sounds in milliseconds and then put them together with the next sounds that come along, and then put those together with the next sounds that come along. And so it's this constant process of, processing, identifying these speech sounds, holding them in short-term memory while we put them together with other sounds, and then hold those in short-term memory while we put those together with more sounds, because we don't talk in one-word sentences or one-word paragraphs. I don't even know how many words I'm up to in this video. Some might say too many. But at any rate, it is something that we have to do really fast. Speech is by far the most complex sound we listen to on a daily basis. Now, that's not all of it. Sometimes we have to process those sounds. We have to process the phonemes as they're coming at us from the person talking to us. But sometimes we also have to ignore competing noise. So perhaps you're having a conversation with somebody at a restaurant or in a classroom. Inevitably, in those situations, you need to focus on the phonemes of the person that you're trying to have a conversation with, or understand what they're saying, follow what they're saying. But you also need to ignore the competing noise around you. That could be other voices. If you're in a coffee shop, it could be the espresso machine. If you're in a classroom, it could be some other kids making some noise nearby. If you're in a meeting, it could be a side conversation going on over here while you're trying to have a conversation over here. So now you're doing two things at once, which human brains are not as good at as we think they are. Um, Really, we don't multitask very much. We task switch a lot and often, but we don't really do two things at the same time the way we think we do. And so you're trying to ignore this competing noise. You're trying to process the speech that's coming at you, all these little quirky little sounds of speech, these phonemes. And then sometimes you might be trying to do another task as well. You might actually be trying to retain what you're hearing and understanding and processing. You might also be taking notes. You might also be writing things down as they're coming in. And so processing speech is actually a very complex task. We just sort of don't realize it because we do it all day, every day, our entire lives. We don't realize how complex and difficult the task is. And then let's say that maybe you're someone who has an attention regulation issue or difficulty focusing, maybe some ADHD, maybe you just didn't get a lot of good sleep the night before, and you're just having a hard time focusing. Well, now while you're trying to process all these phonemes that are coming your way, you have internal distractions and external distractions, and so it becomes harder to focus. And so you might have a harder time remembering what you've heard. You may have a harder time separating what you're hearing from what you don't want to hear. And so really, if we do functional MRIs, if we do imaging of the brain when it's listening to speech, there's a lot lit up in there. There's a lot going on. There's a lot going on. Now, that's what auditory processing is in a nutshell. But let's talk a little bit about how we test for auditory processing. So most of the well, first of all, there really is no, at this point, gold standard for, this is the list of tests. If you go to see 10 audiologists and have an auditory processing evaluation, you're going to get the same tests from all 10 audiologists. Probably not. There's really a number of different tests that audiologists can choose from. And sometimes the tests vary based upon the complaints or the symptoms that the patient we have is describing. But for the most part, these tests will either use speech as the stimulus, or tones or noises as the stimulus, and the patient is asked to repeat the words that they hear, or press a button when they hear a difference in some tones or something like that. And so, but now in our offices at Aberdeen Audiology, we choose primarily tests that use speech as the stimulus. And my reasoning for that is that, no one ever calls our office and says, I can't hear the difference between the birds in my backyard and planes flying overhead. When people call us with difficulties, it is because they are having difficulty following speech. And so, therefore, for the most part, we choose to use tests that use speech as their stimulus. Not entirely, but that's the majority of our testing. But at any rate, regardless of the testing that's done, these tests are based off of norms. And so these norms are usually based on age, The tests we use have norms for 5-year-olds, norms for 6-year-olds, norms for 7-year-olds. And so norms for adults. And so when you when you undergo these tests and you give your responses, your correct answers and your incorrect answers are compared to the norms that are appropriate for your age. And so if you deviate a little bit from those averages, you probably have a little bit of an auditory processing problem. If you deviate a lot, well, then you probably have a pretty significant auditory processing deficit. And now, also, a lot of the tests that are done, they don't just describe for us how much you might deviate from the average, but they will also tell us what types of auditory processing issues you might have. Because really, there's more than one skill that makes up auditory processing. I was describing some of them earlier. There's more than one skill. And so it's very possible to have a deficit in one area of auditory processing and not have a deficit in other areas of auditory processing. So the tests are, you know, utilizing age-based norms, and they're describing the severity that way. But then the pattern of the responses often tells us about what types of auditory processing issues somebody might have. In our office, the tests that we utilize sort of identify 4 different types. One type is what we call decoding. I described decoding a little bit earlier. That's the brain's ability to identify and process efficiently and accurately and quickly all the little phonemes of speech and put them together into words. So that's decoding. And that's a very common issue that we see, issues with decoding. We see that a lot in our office. We also look at auditory working memory. And so you may be familiar with working memory in other areas. Sometimes the term working memory is used in describing computers, how well can computers multitask or do two things at once. But so really, that term was taken from neuroscience. And so the brain has auditory working memory. And I sort of described it a little bit earlier. It's the brain's ability to say, decode what's coming at you, but then also ignore what you don't want to hear or follow. And so sort of doing 2 things at once like that utilizes auditory working memory. And so you might be strong in decoding, but if you're weak in auditory working memory, you're going to have a hard time doing the decoding. The 2 sort of affect each other back and forth. So those are 2 things that we see a lot in our office, issues with decoding and working memory. An issue with working memory might make it harder for you to recall information at a later date. Following multi-step directions could be difficult for somebody with a working memory issue. Difficulty hearing a noise is an auditory working memory issue. We also sometimes see issues with a 3rd category called auditory organization. That's how the brain organizes sound when it comes in. Again, there's, in particular with speech, there's a lot of sound coming at us. And as the brain is processing, it tries to keep things organized as best as it can. Sometimes if people get perhaps multi-step directions out of order, that would be a sign of an auditory organization issue. And then we also see issues with what's called auditory integration. That's auditory integration is the process of, it sort of describes a few things. It's how the brain looks at sound coming from each ear. It's really rare in the real world for us to have the exact same sound going in both ears at the same volume, the same intensity, everything the same. Sometimes it happens under headphones, but even then it doesn't really truly happen. If you think about it, let's say you're riding in a car, you have very different sound in the left ear than in your right ear. You might have more road noise in one ear and more music or podcast noise in the other ear. It could be the same sounds in each ear, but just a different mix of them. But at any rate, it's really rare that we have the same sounds going into the same ear. And so the brain has to sort of look at what's coming into the ears, compare, make decisions using those comparisons on where sounds are coming from. That's sort of how we localize sound. That's how we know where the birds are, or the plane is, or where the person is who's calling out to us. And it's also how we sort of sort of trying to ignore the sounds around us and focus on what we're trying to focus on. So those are the issues that we see most often: decoding issues, auditory working memory issues, organization issues, integration issues. That's sort of how the model that we use for auditory processing is described in those four categories. Now, let's say that you have difficulty understanding speech, difficulty remembering speech, difficulty sorting out what you're trying to hear in competing noise. You come into our office, we go through the testing. And let's say we find there's actually an issue. Let's say we find that you're deviating quite a bit from the average. There's a number of things that we can do to help. It is not a matter of, well, yes, you have these issues. Good luck. Let us know how it goes. No, there are things we can do. And it's not really tips or tricks or hacks. There's treatment that we can do. The treatment that we use most often is what's called auditory training or auditory therapy. This is where someone on our staff, typically over video chat software, sometimes in the office, depending upon logistics, but often over video chat, we do listening exercises with the patient to improve their decoding skills, to improve their auditory working skills. We do some phonemic training. We do some auditory recall tasks. We do some speech and noise training. Believe it or not, if speech and noise is practiced in a methodical, systematic way, we can actually make improvements with that. We'll do some things with auditory organization. Basically, it's 3 or 4 different exercises in the span of an hour, typically once a week. And we usually go on for about 12 weeks or so. And then patients come back into the office and we test them again. And what's amazing is how often we see improvement. We almost always see improvement. It's pretty rare that we don't. Honestly, if patients are attending the one-on-one sessions regularly, and if they are paying attention and engaged during those sessions one-on-one with an audiologist, we almost always see improvement. It's really rare that we don't. So that's auditory training or auditory therapy. We have a lot of success with that. People do much better with that. There's other options as well. Sometimes hearing aids are an option for people with auditory processing issues. Today's hearing aids are very good at boosting the soft sounds of speech and partially suppressing, but not eliminating, competing noise. And that greater separation of speech and the noise floor makes it easier for people to process speech. It's almost like they're putting speech up on a tee. And so that isn't necessarily addressing their auditory system per se, but it is making speech easier to process, easier to remember, easier to understand. There's other things that can be done as well. You can utilize some remote microphones. You can do preferential seating, either in meetings or classrooms. You can work on reducing the amount of background noise where you are. Those things, though, are not always under your control. And, sometimes they can be applied to a classroom, but even, once you age out of, the school system, it becomes hard, or once you leave the school, it becomes hard to control those factors. And so that's one of the reasons why we like auditory training so much. Auditory training, typically, whatever improvements we see, they stick. It doesn't wear off. You don't need maintenance sessions for auditory training. Whatever improvements we see, it sticks. It works really well. So hopefully that gives you a much better understanding of what auditory processing is. Hopefully that gives you a better understanding of how we test it and how we treat it. This is something that isn't something that you have to put up with. This isn't something that you have to live with. There are things we can do to evaluate it and test it and help you along and make life easier. And so if this seems like something that would help you and you can get to us in the Philadelphia suburbs, we are more than happy to see you. Treatment can be done over video. So it's not as if you have to come into our office, once a week for 12 weeks. We have many patients all over Pennsylvania that come to see us, and even from some other states where we are licensed to practice. So if you think we can be helpful, give us a call. Even if you're wondering if we can be helpful, give us a call and we can answer your questions. And hopefully you found this video helpful, and we'll see you soon.